Welcome to it, everyone. Welcome to yet another episode of Connections, 7:15, channel 319. You are tuned in to the right place. How are you guys doing tonight?
Very, very well, thank you. And yourself?
I'm super. And to my left, we have a guest presenter, which I must say I'm very excited to have. Welcome, Abram. How are you?
I'm fine. I'm superb. I'm all chilled.
All chilled.
Yes.
So, like
I'm all pumped. This is home.
This
you know,
is
as
home.
they always say, home is where the heart is.
Of
but it's,
course.
Unfamiliar
it's good to
with
see
you, just tell
another
them.
side of home.
Yeah,
Definitely.
yeah.
And also, I came at the right time because it is Wellness Wednesday.
Wellness
So I'm ready
Wednesday.
to learn a
We
lot
love
about
that.
health issues.
Yes. Now let's do it all together, guys. You know, Wellness Wednesday, we are talking all about the mind, the body, and the spirit.
All right.
You could add more enthusiasm
We've learned
to
something
it.
new.
I'm telling you, sorry.
Covered. You Zoktola. Yes, guys, you heard me. It is all about the mind, your spirit, your body. We will be talking about that. And today, tonight's topic is rather a very serious topic. We are talking about eating disorders, guys. Eating disorders, we know that affect a lot of people, and many we don't know about, many we do know about.
Yeah.
So get in, engage with us. We want to hear from you guys.
Of course.
It's also quite interesting. In fact, earlier I was thinking, when you think of eating disorders, first thing that comes to mind is, you know, women or young teenagers
Yeah.
or, you know, girl side of life. But you do get guys as well, you know, that are affected by such. And, you know, they also have their eating disorders, although they might not be, you know, too public about it
Yeah.
as
it is hard to
girls were.
admit.
Yeah, some of them will struggle to admit that, hey, I actually do have an eating disorder, you know. So that's what I was interested about. And yeah, we've got a jam-packed session
It's
tonight. Yeah,
jam-packed.
jam-packed.
Definitely. We have an expert coming in. I'm excited
Definitely.
for that.
So am I, yeah.
So with what he said, I want to know, do you know of any guys that are affected by eating disorders?
Well, I've seen a couple of them, one or two. But before we get into that, I'd like to tell the people where they can get us. Because I want the
Definitely.
people to talk at home. Well, we've
Take
got
it
the big
away.
five. If you don't know by now,
can't
you
know
should
Yeah,
Yeah,
know
the
it.
big five.
Firstly, we're on Facebook. You can hit us on facebook.com/connections. Remember, it's with an X.
An X.
Yeah,
Yes.
join us on Facebook. On Twitter, follow us and we'll follow you back at Connexions. Again, it's with an X. 319 though, because we are on channel 319.
Yeah.
And another thing, you can SMS us on 083 44 88810. That is our SMS line. We can also take your calls, call us live. We'd like to hear you.
We want to
Hit us
hear
with
from
the
you
bellas.
guys.
Yeah.
Yeah,
hit
bella
us.
us.
Yeah, bella, not to belela.
So Bella,
Yeah.
please call.
No, no, please calls.
Not applicable.
No.
Okay, Tim Belela then
Yeah.
on 086-105-8262. That's how we do it. We'd like to hear from you guys
Yes.
because we are connecting, so we should connect with the people at home.
Connection.
We should get on Instagram and have it like the big six.
We should be, okay, and also BBM because I'm a big BBM fan.
So then it'd be like the
Everyone's
big
leaving.
seven.
So it's going to be the big seven
But
But
everyone's
what would we
leaving that
post on
for
Instagram?
for WhatsApp.
Photos.
pictures of everything. Hey, picture of my shoe.
Oh,
Hey,
wow.
we've got an expert tonight.
Listen
Hey.
to Well, guys,
Everything.
on that note, I would like to point it out that, please, guys, let's be sensitive tonight with your feedback. This is a sensitive topic. People suffering from eating disorders are suffering already. It is enough. So we don't want no judgmental Judies. We don't want anybody who's just going to be like, you know, judgment. We don't want that. And guys, we
it
are a
clean.
supportive community. So supportive. That is what we are all about. So
After all, we do want to, you know, help those who
Yeah,
are
we
in
wanna
such
help.
an issue, you know, and by you being all, you know, criticizing them and in this issue, right, in this issue, those constructive criticism, it isn't really constructive in this instance. So by those, you know, hurtful, you know, posts or
Comments, yeah.
comments or whatever it is, you may discourage those who are in that, you know, dire situation and, you know, do seek help, you know, just to shun back a little, you know. So
And it's so easy for us because we are on the outside. We don't see, we don't know what's
Yeah,
happening. It's easy to us to just bash, like,
So true.
go get a burger.
Yeah,
Why don't
yeah.
you just eat? It's so simple for us to say that, but that's not really the case.
true.
So it
All
takes
those
someone
who
to
are-
really find out what's really
Going on?
Yeah.
Also, we want to educate those who aren't aware of all these eating disorders, or, you know, an anorexic person, or you will highlight a few of them now, the different stages of them, different types of them. You know, if you see that person, some people are just like, just eat, as you said,
Yeah.
grab a burger or something. But it all comes with education, being well educated on this topic. Then you'll understand what position those people are in.
Yeah.
I mean, if you're not affected, someone out there, that you know might be affected.
Yeah.
And
Yeah,
so
yeah,
this could be a great help to them because
Definitely.
we are a helping nation. We should help
Even
one
if you
another.
don't know anyone that's affected, because some people only when it's a close relative or close
Yes,
friend
yes.
is affected by this. Even if there isn't, I don't know anyone that's affected by this, but it's also interesting for me to learn and to,
Yeah.
just get more knowledge on
You
it.
might need it.
I might need
Coming
it.
50
I might
years.
need it, yeah, or never know, a few
And we
months.
were talking earlier actually that, people have this misconception that you hear eating disorder and the first thing that springs to your mind is anorexia.
Yeah,
We
yeah,
don't
yeah.
focus on all these other eating disorders that are out there, and there are quite a lot.
Yeah,
So because we are talking about such a very important and very serious topic, I would like us to start with a proper definition of what eating disorders are. So according to Wikipedia, eating disorder is any of a range of psychological disorders characterized by abnormal or disturbed eating habits such as anorexia nervosa. So
Where's
psychological.
Unati with a big word of the day to break that down for us? Yeah.
What? Okay, well, Abraham, would you like just break it down for us? What do we have?
All right, we have three types, common types of eating disorders that we know. As you first started with the anorexia, it's the common one. People
It
know
is
about
common.
it.
Yeah,
It's
yeah.
basically people who normally restrict themselves from eating a
Yeah.
lot, being affected by certain distortions such as their body size and their body shape. It affects them a lot, and sometimes how people see them. So they normally want to keep their weight, underweight.
Underweight.
And, keep it fit.
Way underweight.
Yeah, way underweight, keep it fit and slim. And then the second one, it is bulimia. Bulimia, it is similar to anorexia, but its difference is that people normally eat a lot,
Yeah.
they binge a lot, eat excessively, and normally they compensate that with vomiting and forced vomiting.
Oh my word.
Yeah.
Hold up. So I've got a heap of food. Gobble it all up. Once I've done that, I regurgitate what I've just consumed.
Yes.
Yeah,
Ex-
basically.
Exercise?
Basically.
Point of the exercise?
And also exercising. They do exercise, excessively so, I believe. They do exercise, but it is just something that when you've eaten, you need to pay for that. So
Yeah.
you compensate that food with doing something, forced something, whether it's being forced to
Wow.
exercise or being forced to vomit.
So I think they
Very
have this
scary.
thing that, okay, I'm eating, I get a taste of it, and then I take it all out before the calories are absorbed into my body. I don't know,
Yeah,
that's how I
yeah.
would understand it. Yeah.
And the
we
risk
need
with
an
that
expert to clarify on
Yeah,
that
we
as
will
well.
have the expert to clarify.
And the risk with that, it normally said that it affects both your emotions and your physical body.
Can imagine
image.
I can
physical.
imagine the
Yeah.
throat, like, constantly putting your finger down.
It's not normal. It's not normal for
Well,
everyone.
you're being forced. It
Yeah.
doesn't have. You don't have to like it by any chance. You're being forced.
I've also
Yeah.
got another one here where it says eating disorders not otherwise specified.
That
Also-
one comes after the last one,
Oh, yeah.
which is binge one. Binge one, it's more like bulimia,
Yeah.
but its difference is that people with binginess, they don't compensate. So you just eat, can take a 6 packet of chips and eat them at the
Ooh.
same time. You don't compensate anyway. You just
Hunger
keep on
strike.
eating and eating.
Yeah.
So that's
And I love that because at the moment there
You
is
love
a-
that?
No, I don't mean that.
You love the way it is put, perhaps.
No, yeah, okay. I love the explanation
All
to
right.
that, Abram. Okay, because right now there is a local soapy that we all love to watch. What it's kind of at the moment, it's showcasing a girl who's going through that very binge eating disorder. So she will like eat in the bathroom. And yeah, she's just like, she is overweight and it's quite sad.
And that's always the case, and there are health risks that are involved with that. At the end of the day, people might even have heart attacks
Yeah,
because
yeah,
of
yeah.
that. So it's always wise that you keep your. I believe through that soapy also, they're trying to teach people to
Yeah.
be health conscious. Be careful of what you eat. Hence, that girl is in a challenge
Well, hence
to
that
lose that
character.
weight.
Yeah. And with what I've also mentioned earlier, that eating disorder not otherwise specified, also shortened as EDNOS, right? And the causes of that can be biological, Physical and environmental issues can also have a play in that. And lastly, social. All influences that can affect to this. That eating disorder not otherwise specified. This was new to me today.
Now, I want to get into it, like having your body image. How is it affected to eating disorders? A negative body image, actually.
Yeah.
Do you think it's like a major, like, do you just, because for me, I see it like maybe you'll start by saying, I want to lose a bit of weight.
Yeah,
and then you get addicted
to
it because you see yourself and you're like, I don't like the way I look.
Yeah,
and then that's when the cycle starts.
Restrict. And due to that pattern developed, you've developed that habit and then you get addicted to it, I suppose. But yeah, it's not a good thing. It's not.
Yeah.
But having mentioned such issues, social and environmental, I also believe that body image counts a lot. We had a show on body image.
Yes,
that
a
a lot.
weeks ago.
So it's also how people feel about themselves, and they'll end up having those eating disorders, and at times how the environment or how people see them. And then we actually take that. If you as Dekan, we like, okay, we think you're not big enough. Or you, Abraham, we think you're not big enough, you should eat a lot. And then I start take that from people, and I begin to...
So it's what society throws to you that, now I feel like I gotta lose weight, and then...
Moral of the story, don't value their opinion to an extent.
It's all about you. It's all about you. Your image counts a lot. So at times, before taking a look at what people say or what the environment says or what your family says, because some of us are being affected by our families, the way we grow up, and how we eat, our diets at home.
The pap.
I'm a queen, I'm a queen,
Well, guys, let us cut this short. But after this short ad break, we have an expert. She goes by the name of Nikki Muniz. She's a counselor from an addiction recovery center. So make sure that you join us straight after the short ad break. Welcome back from the ad break, everyone. If you are just joining us, don't worry, you didn't miss out on much. You missed out on the first segment, but don't fear, a lot is yet to come. In the studio, we have a very interesting guest, Miss Nikki Muniz, and she's a counselor from an addiction recovery center. Hello, and welcome to the show.
Hi, thanks for having me.
Thank you for coming. Well, could you just tell us a bit about yourself?
Sure. I work at Houghton House, which is an addiction recovery center.
Okay.
We deal with substance abuse and any related disorders.
Okay.
So eating disorders would be related to substance abuse.
Why did you get into that field?
That's quite a long story, but I'm quite passionate about what I do. I've been doing it for a long time. It's definitely more of a calling than just a job. And generally my hours go well into the night. It's not really a 9-to-5 kind of job.
Wow.
No, that's very great because you're also helping a lot of people, with that as well. It's not just a career path and this is my occupation now and this is what I'm doing 9 to 5, as you say, an hour lunch or whatever it is. But a lot of thought goes into that as well. And I imagine there's also some tough emotional things for you that would, go with that as well, because you deal with these people and then obviously rings in your mind, even if you're sitting privately with family,
Absolutely. In fact, I need a whole ritual before I go home to make sure that I leave my work at work and don't take it home with me.
With you,
Wow. So from a professional point of view, I would like to know the causes of eating disorder. Like biological, if there is any, biological, psychological, and environmental.
Sure. Well, in terms of biological, I believe that addiction is genetic, so that definitely plays a role. But I also think in terms of genetics, whether you are supposed to be fat or thin or medium, obviously you've got no control over that. In terms of psychological, this is more than just about skin deep. It's not just about the way that someone looks, but it's also about an inability to cope with certain feelings, a need to be constantly in control or out of control to sort of feel normal. And then in terms of social, obviously the role that media plays and what society expects people to actually look like.
Your peers as well.
Absolutely.
Because you get that you're in a group of friends and you're the one who's like a big bodied girl, and then you just kind of get into like this thing that I want to be like my friends or the rest of my classmates.
Sure, and kids are mean.
They are.
No, they are.
Oh, they are.
You just said goal there. Brings me to this point. We had this discussion earlier. is it only girls that are affected by this? Because I thought maybe guys are as well, but I need your input on this.
Definitely not only
Definitely not.
girls.
Okay.
I think, like you said earlier, that the first thing that pops into someone's head when they think about eating disorder, they
Yeah.
think anorexia.
Yeah.
But certainly something up and coming. What we also spoke about earlier was bigorexia. It is particularly the boys in the gym wanting to get bigger and bigger, almost look like they've taken a bicycle pump to themselves. And they look in the mirror and see themselves as small, just like
Small.
someone with anorexia would look in the mirror and see themselves as much larger than what they actually are in reality. So that certainly also binge eating. You often see men that are severely overweight.
Yeah.
That is a lack of control around their eating, unless there's obviously some sort of biological issue like a thyroid that doesn't work or something like that.
Yeah,
Sure.
Do you think there's like a specific reason why the focus is mainly on us girls?
Well, I think that girls are a lot more vocal about it. And I think that also in terms of the media, when you see the really skinny supermodels, like you think girls, you know, you're not
Girls.
thinking that the guy is standing in the mirror looking at himself and absolutely hating the reflection that's like
Yeah.
staring back at him.
And other ways of, do you have ways that we can prevent teenagers from actually getting into this vicious cycle of eating disorders?
Well, I think that the most important thing to acknowledge is that an eating disorder, like I said, is not just skin deep. This is related to someone's self-worth. So the best combat that we have is to work with the value that they hold for themselves. So as parents with kids, you need to constantly reaffirm their value. If you are telling your kids that they're stupid and worthless, then you know they're going to believe that about themselves, and it can possibly develop into an eating disorder.
Brings me to my thought as well. I was just about to ask you, what contribution do families have, you know, to these ones that are suffering from such? But you've touched on it a bit. But now the supportive aspect on it. You know, how can families be supportive? You know, not just criticize the whole time, so you're so stupid, the fridge is full of food, why don't you stuff yourself up, and everything. Just that angle, what do you think?
Well, I think that families need to offer emotional support and possibly get therapy as a family, and to realize that this is not just about food and about what the person looks like in the mirror, that there's a lot more deeper issues involved, and that the whole family can get a better understanding, you know, bearing in mind that knowledge is power. So, you know, to come from a really educated perspective is a lot better.
Oh,
Okay, and then we've spoken about media, and that media has instilled all these funny beliefs in us that skinny women are better, blonde are better. But now, in terms of eating disorders, what can you do? What do you think we can do to rectify this? What the media has created?
I think that the media has been trying. I know that they often have these like supermodel shows where the women are a bit bigger, and they try and tell you that women are airbrushed and they don't really look like that. And you know, the fact that these women look like that because they are starving themselves and essentially are doing a lot of damage to their bodies. So I think, like I said, it's just about knowledge is power. It's about knowing the truth, that it's not normal to be below your normal body weight. So you know, it's people getting educated and understanding what it is, what your normal body weight is according to your height, what's healthy, and that it's not just about what's on the outside and more about what's going on the inside too.
You mentioned the biological part of it, hereditary, I'd also suppose. What did you say earlier about it?
About addiction being genetic.
Yes.
Yeah, that's what also interests me. I'm wondering, like, if I'm addicted to alcohol, can we blame it on genetics?
We believe that genetics play a huge role. And that often we find that there's an auntie or an uncle or a mother or father or cousin somewhere along the line. And then also people think about only substance abuse when they think about addiction, and they forget, you know, there's shopping and gambling and eating and all other addictions that also come into play. So there's always that like uncle that no one invites to parties, you know, because he's just embarrassing. And so when you ask someone, have you got addiction in the family? Like, no, I don't think so.
And also there's this thing that eating disorders are a lot, actually, they're associated with white girls. Now, is this like true?
Stereotyping.
Absolutely not. I think that with the change of economic standards in this country in particular, Even in the facility that I work in, we are quite an upmarket facility. I would say that the ratio of black patient to white patient, far more black patients these days. And so often, you know, they come in with a coexisting condition of an eating disorder, that they're also all about what they look like and the image, and, you know, in terms of their social standing in society, you know, they need to pay attention to what they look like. Also bearing in mind that we also get a lot of people in this particular industry actually coming into treatment, and then it's really about what you look like.
That's awesome, because there's this whole stereotype that, it's, you know, often the white folk that suffer from these things, that go to these rehab centers. But your ratio there is also quite interesting, that there are not just black people, but like non-whites also, you know, other races as well. Because you'd often see other races, be it in Thailand or Southern Africa or even North Africa, and you look at these people that are under these conditions, you're like, oh, it's definitely kwashiorkor, that's definitely poverty, or what have you. That's the, you know, reality though, you know.
Definitely.
So it's interesting just to get that cleared, that it's not
necessarily... It is an eating disorder.
It is an eating disorder.
And how long does the recovery take?
Sure. With a substance dependence, we can teach complete abstinence, so that's kind of easier to work with. Obviously, when it comes to eating, we can't teach abstinence. So we have to teach someone how to live around it. So only long-term treatment really has any sort of success rate in terms of eating disorder recovery.
Sure. Okay, and the age range quickly for in your center?
Our age range in our center is from 17 upwards. The most eating disorders that we see is probably around 17 to 40.
I would hope younger than 17 aren't there, because that's when you need your food. That's when your development, you know, is at its...
Well, unfortunately, in facilities that take minors, they're taking in patients as young as 8.
Sure. Well, guys, this has been a really insightful... It has been really insightful segment. It's time for us to take a quick break, but we'll be right back after this short ad break. Don't go anywhere. Welcome back from the short ad break, you guys at home. If you're just joining us, OMG, where have you been?
Where have you been, for real?
We have Abram with us, guys. He is our guest presenter for today. You know him from Learn Extra Live.
Exactly. Been getting some comments also on Facebook. Guys, hit us up on Facebook, and we'd like to hear from you. Our page is Connexions with an X. So like the page, and let's get to hear what you have to say.
We want to hear your stories.
Exactly. Because later on, we'll be taking some of the comments.
Yeah, and we still have Miss Nikki Munitz in the studio with us. Well, guys, in the previous segment, rather, we were talking about very interesting things about what eating disorders are there, blah, 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 blah. If you missed out, catch the repeat. Well, let's get straight into it. I would like to know, is it easy for family to spot when somebody is having an eating disorder?
Unfortunately not. You know, people have this misconception that if someone's been restricting what they're eating, that they're going to be this walking skeleton. And that's usually not the case. You know, they might be below their BMI, but they look quite normal on the outside. Also, someone who has been purging is also not going to be thin either, because they are getting some calories. Their body is holding on to some of that. And so they're also going to look just like any normal person, you know, unless they've been doing it for a long time. Someone that's been purging, one of the signs to look out for would be stained teeth, obviously from throwing up. Going to get a bit graphic now, sorry.
Not a problem.
And also, you know, they use their fingers a lot of the time, so they get these bumps on their fingers from using them, until eventually they either start using other things to actually make themselves throw up.
And that's something totally different from people who are using drugs.
Completely different.
Okay.
Completely different. And then also sometimes they actually get to a stage when they've been doing it for so long that they don't need to put anything down their throats, and they can actually just bring it up. Sure.
Wow.
So, and you know, they're doing a lot of damage internally to themselves, because you need food to live, number one. And number two is, you know, the stomach acid's doing a lot of damage. And also, you know, your organs have fat around them. They need the fat in order to like be safe. So a lot of girls with anorexia might not look skeletal, but their organs will slowly start to shut down because they don't have enough support around them.
Very risky. But then eventually, if the family finds out, what's next?
Sure, it's such a difficult thing. You know, there is such a lot of denial around an eating disorder where families don't want to acknowledge it, so that's their denial. You know, they don't want to talk about it. It's kind of like this elephant in the room. And then also for the person involved, you know, they don't want to let go of it. So as soon as you confront them, they'll get either quite defensive or brush it off. And they don't want to, like, as soon as they start talking about it and acknowledging there's any sort of a problem, that means they're actually going to have to do something about it. And so it's quite hard to do any work around that.
Excuse me. Oh, okay. And then let's talk about the road to recovery. What is recovery? What are the steps to recovery?
Okay. I'm going to speak obviously from our treatment centre's perspective. The recovery from an eating disorder is long and drawn out, and there are quite a lot of glitches along the way. Like I said, it's something that people have to learn how to actually live with. And it sounds quite strange, but someone with an eating disorder, whichever eating disorder it may be, will look in the mirror and they will not see a realistic picture staring back at them. So, and they may never. You know, the reality is they may never see what everyone else sees. And so they need to kind of just trust someone. They need to build a relationship with a therapist that they can trust, that will say to them, it's okay to eat this amount of food, it's healthy for you. And then it's just about doing work around their self-esteem, you know. If someone's got quite a high value for themselves, they're not going to want to hurt themselves in any way by either binging or restricting. So I always explain it to my patients, it's like having a self-esteem bank account, and it's about making deposits into this bank account. And the more deposits someone makes, the more decisions that actually add to their value they'll actually start to make.
So in simple words, eating disorders not only affect your body, they also affect you emotionally, so, and other parts of your senses.
Absolutely.
You see, now I've never been able to understand this. You look in the mirror and something totally different reflects to you. And I guess you won't understand until you find yourself in that situation. And that's why we shouldn't judge, really.
So true. And that is why I think it's very much important that we should have some supporting networks out there. Are there any that we have at the moment?
Absolutely. Well, obviously there are facilities that treat this, but there are also free self-help groups like OA, which is Overeaters Anonymous. They don't deal specifically with only overeating, so people that are anorexic or bulimic can also join their support group, and they will work a 12-step program like Alcoholics Anonymous that you've all seen in the movies, where everyone says hi.
I'm Dika.
That's exactly the same program,
exactly the same.
but in terms of an eating disorder. So there are a 12-step program that is related around eating disorders. Yeah.
Nice. We're
Really
learning a lot. So actually, I've also been given that confidence to help someone out there because I have the information now.
Yeah, definitely. Like watching this show, you can definitely go out, pass it on, and make it known that this is real, it is alive, it is affecting us, guys.
So
and then, is an intervention by the family always necessary for the victim?
I think, you know, when I talk about substance abuse, you know, often the person can start to see for themselves that their life is kind of becoming unmanageable and falling to pieces. When it's around eating, it's obviously a lot more secretive and there's a lot of like shame around it, and they don't want to talk about it. So even a family intervention can not always go according to plan, and I definitely suggest that, you know, some help of a professional be part of the process as well. But they need to be in a place where they are starting to see that there's a problem also, because often the family can see there's a problem long before the person involved.
All right. I think it's time to take some of the comments that I have on Facebook and comments too. I have a question from Grace Vivian. It says, if I lack an appetite for food and eat less because of stress, is it also considered as an eating disorder?
I don't think that that would be considered an eating disorder, but I would certainly suggest seeing a doctor if there's a loss of appetite and some sort of anxiety disorder possibly developing there, and could obviously develop into an eating disorder if left unregulated. You know, I think that you guys spoke about earlier that as someone starts to lose weight and then becomes addicted to that and then almost loses control, you know, and before they know it, they're kind of like the thought of actually eating something becomes like actually nauseating to them.
All right, another question is from Mosia Kladi. It says, I often tend to eat so much, even if I'm not hungry, during the exam times. What do we call this kind of disorder? I know that we've given you the types of, the common types of disorders. But this
Okay.
one?
That would be bordering on binge eating. It's eating around an emotion. So most eating disorders are around emotion. For example, if someone is anorexic and they're restricting the amount that they're eating, they are feeling out of control in their own lives. So they find difficult emotions hard to process, things like anger or sadness. So when they control their eating, they feel more control in their life.
in their
And
lives,
someone who is writing exams obviously is quite stressed and feeling out of control, and they just kind of go with that. So they lose control all round. And that's obviously really, really unhealthy. So, you know, the focus is moving more towards like a really health conscious diet and learning what the right portion sizes are, so, you know, that you can actually curb that.
Well, I think the guys should keep the questions coming.
Yeah.
But we should move on now.
Yeah, linked to that Facebook comment, could it ever be termed normal? Like you stressing and you just sit in your room studying with the books are stressing out, and you just eating. Just could it ever be seen as normal?
I think it is, but that's why I said it needs to be kind of regulated and watched. It's the same like any addiction. Doesn't start out of control. You know,
So
like
time
someone
is
who's
just
abusing a
driven by
substance,
emotion.
just experimenting, having fun, and then the wheels kind of fall off and it gets out of control. And the same kind of happens with an eating
So you
disorder.
can get used to it, and then it can lead
Sure.
into.
I mean, I think that, you know, if we're talking about girls, for example, you know, wanting to lose some weight for the matric dance or for your friend's wedding, or whatever the case is, you know, and then it just gets completely out of hand.
But I've always failed.
Well, I can imagine trying to get that six-pack, and at the same time, I'm losing weight and going to gym.
Dude, come on.
Yeah, it's such a stressful mission.
Yeah, it
but
is.
otherwise, it's possible to keep healthy at the same time without having any of these eating disorders. But what are some of the major challenges that people are facing in terms of treating these eating disorders?
Well, I think the biggest issue is the fact that there's such a lack of education around it. And there's still so much kind of shame and stigma, you know, and people just really don't get what it's all about and kind of think that it's all about ego, and you just care too much about what you look like if it's on, you know, the anorexic side, or don't care about what you look like if you're on the binging side of things. And it's really so much more in depth, and it's really about the fact that this person is so sensitive that they can't deal with their feelings and they can't talk about it, and, you know, it might be like activated or kind of aggravated by some sort of trauma in their childhood or something that's going on at home that they can't talk about, you know, and they're judged at face value, you know, and I think that's pretty sad because people then don't want to talk about it.
Yeah, I mean, as we said earlier in the show, we are on the outside, we are spectating, we don't know what is going. It's like, I'm totally off ramping, but it's like watching soccer at the stadium, and you see the guys, and you just want to judge, Kabibolo, score, and you're like, you are not there, so don't judge and don't be like too up in the ears.
What a great example with soccer people. Soccer fans are just something else.
They are fans.
But I think from understanding what Nick is saying, the society plays a very big role in shaping how people view eating disorders, and also trying to make also people that are suffering from eating disorders inferior in a way.
Sure. I mean, I also do a lot of talks at schools, and, you know, I was a teenager once myself, not that long ago. And I think that there's just such a huge pressure, you know.
All right. I think we have a call on the line.
Oh, great.
Oh, yay. Hello.
Hello? Hi, how are you? I'm also good. Who are we speaking to? All right, Viseka. What's your comment or question?
Yes, I have a question for the expert in studio.
Yes.
Yes, I just want to find out, like, the relationship that your family teaches you with food, like, does that affect how you think about food?
Oh.
The family.
Okay, you got that?
All right.
The relationship that your family like,
Yes.
teaches you about.
Teaches you.
Yes.
Yeah.
Sure.
Thank you so much, Paul.
Viseka, thank you very much for your call. What a relevant question. Thank you.
I think that
Bye.
most cultures, particularly in our Rainbow Nation, centers around food. When we're happy, we eat. When we're sad, we eat. And it's, you know, everything kind of centers around food.
Yeah.
So, you know, there's definitely a learned behavior around that from our parents. But also, you know, we can also learn to eat a lot more healthy, you know, and it's less about being thin or fat and more about being healthy and active, you know, and having energy to actually live a productive life.
Oh, but have you seen the Christmas tables? Yo,
It's
the
to die
Christmas
for.
tables
It's
are
to
like,
die for.
yo, you get everything there. So it can be
But
quite
not
difficult.
Only, not only that, I mean, some people will have that every day, not only on Christmas Day. Yeah.
Really? You're saying
Yeah,
some
even
people
you
have
fry every day.
Christmas lunches
Christmas doesn't come
al
once a year to some people. It's an everyday thing.
You know, I think that a lot of parents also work full time. So when mom comes home from work, she doesn't feel like, you know, spending time in the kitchen and cooking like a healthy meal. It's easy
Yeah.
to
So
kind
true,
of like,
so true.
you know, the quick fix, you know, like hamburger and chips, whatever, like slap it on the plate. And people kind of learn
Alright,
to,
we have
to
another call,
eat like
sorry.
that.
We
Okay.
have another
We have
call.
another call.
Yay!
Caller, we are live on Connections. Hello.
Hello, sir. How are you?
I'm fine, thanks, and you?
I'm right. You speaking money?
Two?
Yeah, I just wanted to ask, how does one get to intervene, especially if be a teacher, and then you see that there's a problem? What's the best way of intervening without even hurting the person that you're trying to help?
Oh, okay.
Thank you very much.
Thank you very
Okay,
much,
thank
Mr.
you
Bolani,
very
your
much for
call. We
calling.
appreciate the intervention.
You know, obviously a lot of factors come into play in regards to that. Obviously the age of the person involved, you know, if it's a minor, you know, you'd have to get a professional like a social worker involved, but definitely some guidance from a professional of some sort in terms of how to actually approach the person and to have a plan in place that should the intervention not actually go according to the way that,
What
you know, that you'd
happens?
like it to. So, you know, there's ways to actually force someone into treatment, because also remember, when someone hasn't been eating well, their brain is also not functioning at full capacity. So, you know, they're not thinking rationally, and they might need a bit of help and some time, you know, actually being force-fed for a while until they actually start
Sure.
thinking rationally.
But thinking out loud and judging from what the caller is saying, an intervention in schools, maybe you're a teacher, would you suggest that as a nation we start having some social workers at schools that will look at such issues?
Yeah, I think that, you know, people are always trying ways that will work the best. You know, like I said, I do a lot of talks at schools,
Yeah.
and I try and keep it, you know, on a level that makes it open for people to talk and to ask questions and to relate to. But I think that there's just, you know, like this shame attached to it, that people don't want to come forward. You know, I'm not sure if I was a teenager now, if I would go and see the school social worker and tell her about the problem I was having.
And you know, when you're coming out of the social worker's office, or
Everyone is looking
everybody's
at
just like all eyes
you.
on
I didn't know you had a
you.
problem.
Yeah, so
But it's something that we need to remove.
It
that
needs to be-
stigma, it needs to be
yeah.
removed from the society also.
Sure.
But then, but then talking about the stigma being removed, I believe that media, as we've said earlier on, it plays a big role. But now, as someone who has worked with such people, who has went to the schools, do you think that the education arrived that has been driven enough?
It's never enough.
Never enough.
It's
Never
never
enough.
enough. You know,
Wow.
there's just like so much education needed, and it's not just for, you know, the people at school. Their families need education. You know, we were talking about, you know, getting like one of the big breweries to come in and talk about alcoholism, you know, and it's just, they're not going to, you know, because it's kind of like defeating what they do for it to make money. But, you know, around this, I think that you need channels of communication to be open. So shows like this, I think, are awesome, you know, for people to phone and ask questions, or if they're too shy to ask questions, to at least get the information. I mean, you can Google things like OA.
Information is out there. It's up to you to
Sure.
yeah,
get
and quickly, yes or no? Do you think boyfriends or girlfriends play a role in how we see ourselves?
it. What a question.
I think that there are people in our lives that feed what we believe about ourselves already.
Okay.
I
Okay,
truly
and your
agree.
final words to the people at home?
I think my final words are to be open and be willing to get the help that you need if necessary, and be willing to help other people if they need it, and to not worry so much about what is on the outside, and to worry a lot more about what's going on in the inside.
Yeah.
Beauty does not last forever. Being young doesn't last forever,
Well
unfortunately.
said. Thank you very much. Yeah, really
Yeah,
appre-
thank you so much, guys.
I've really
Thank
learned
you
a lot
so
from
much.
Nikki,
We've learned.
hey.
Thank you for coming to the show.
High five.
It's been a great show. Thank you, guys. Join us tomorrow. Mwah, we love you.
Peace.
Bye.
Bye.